This is what our shitty ass healthcare has come to, where my patients need medicine and supplies and their insurance won't cover it, and here I am spending my own money because my patient needs it, and he doesn't have any money and he can't work. And the insurance won't even cover what he needs. And I'm sad and I'm sick and tired of it.
Make this make sense. My daughter gets food poisoning. She goes into the hospital. She gets the bill for $2,500. They in turn tell her, hold on a minute, we got to put your insurance on here. And now the bill is $5,000. Welcome to the American system of broken health care. This is ridiculous. Just self-pay $2,500 with insurance $5,000. Plus, they probably racked up the bill like crazy on the insurance company. This is a broken damn system. Just slap broken.
So we have more troubling news because of Trump's handling of the economy and the healthcare crisis. United Healthcare just announced that they are removing 1 million senior citizens, 1 million from the United Healthcare Medicare Advantage plan. 1 million. Why are they doing this? Because their profits are tanking. Why are their profits tanking? Because medical care costs are increasing. Why are they increasing? Because of the upwards of $1 trillion in cuts to Medicaid and Medicare. And because there are so many more people now uninsured. They can't afford these premiums. And no, they're not illegals. They're American citizens. But all of these people who are increasingly uninsured still go to the hospital, still need emergency care. So that gets passed on in the form of higher medical costs to those that are insured. Now, the 1 million senior citizens on the Medicare Advantage program is considered a low-hanging fruit for United Healthcare because they're specifically targeting senior citizens on low income. They pay the lowest in premiums, but they utilize a lot of medical care, so the return on investment is getting poorer and poorer for this for-profit healthcare company. And those million senior citizens, a lot of them are located in red states. This affects you too, Trump voters. Seniors who voted for Trump, this affects you too. What's most troubling is that economists are saying what United Healthcare is doing is a leading indicator of what's next, what's going to be done by other for-profit insurance companies. And once they cut senior citizens off of these plans, you better believe it, they're going to go after other programs for insuring people who are not senior citizens. Great job, Trump.
If you think healthcare is bad now, you are not ready for this. Starting January 1st, the Trump administration is launching a Medicare program where AI decides whether you get medical care or get denied. Not your doctor, not a specialist, a computer. And it's not a tiny test. It's rolling out in Arizona, Ohio, Oklahoma, New Jersey, Texas, and Washington. 6 states, a program running all the way through 2031. And here's the part that they're not advertising. This entire system is copied from private insurers, the same companies notorious for denying cancer treatments, denying surgeries, and telling patients the algorithm said no. NBC News exposed it. This program expands prior authorizations, the #1 reason patients get stuck waiting weeks for basic care. KFF confirmed the nightmare. The AI is literally designed to weed out care by denying more of it. They even gave it a crude name, Wiser. Wasteful and inappropriate service reduction. In other words, cut costs by cutting care. And we already know what AI denial systems look like. doctors reviewing claims in 1.2 seconds, physicians warning AI is increasing denials, algorithms programmed to reject expensive care because patients eventually give up or die waiting. And now Medicare, a system for seniors, disabled Americans, cancer patients, want to use the same playbook. Doctors, researchers, lawmakers, they're all warning this could deny life-saving care and override doctor decisions. And the timing? Unbelievable. Dr. Oz literally said prior authorization erodes trust. Then the administration rolled out its biggest AI expansion ever. So which is it? Is it dangerous? Or is it your new gatekeeper? People aren't begging for AI. They're begging for a doctor who can treat them without fighting a machine. But instead, we're getting an algorithm standing between us and our healthcare. And if this does not piss you off, it should.
My health insurance is increasing from $417 a month to $1,002 a month if I want to keep the same doctors, have similar deductibles, and the same copays. Here's my old health insurance: $40 copays, $80 specialist visits, $417 a month. Here's what I'm looking at now for the same copays, deductibles, and my doctors covered: $1,002 a month. After turning 26 and having to get off my parents' healthcare plan, I finally had found new doctors and a new therapist. But in America, you don't get to choose your own doctors. Your healthcare plan does. And after my previous healthcare kicked off 1 million people, I'm now having to decide between paying an additional $585 a month to keep my same doctors or abandon the care team I just built and find a cheaper plan. I'm pissed. This is what happens when Republicans cut ACA subsidies to give tax breaks to billionaire CEOs that are the ones raising our rates. 22 million people are watching their costs increase in January. And the craziest part is, more Republicans than Democrats rely on these ACA subsidies. This shouldn't even be a partisan issue. Yet Republicans have no interest in extending these ACA subsidies and have presented no plan to make healthcare more affordable for millions of Americans. I know a lot of people are in the same boat, and I just want you to know, you are not alone.
Thanks for clicking to watch today's video, and also welcome back to our channel. America's health system is falling apart, and the people who cheered and thought and actually swore that it was the greatest are now facing the truth. Yes, the MAGA people are facing the truth about the health system of America, and actually they are right now realizing that indeed the slogans don't go well with everything that happens, because they cheered on Trump when he told them he was going to protect, their health and everything. But right now, it's like they are facing karma. We've prepared this video for you. We do not own the rights of the video. They belong to the original owners of the video. So let's dive in and hear the reactions of Americans and how they feel about this health system. I'll be back with my commentary, so stick around.
The U.S. healthcare system has about a month before it breaks. ACA premiums are projected to jump up 26%, and people can't afford it. So when people can't afford insurance, they go without it. They split pills, they skip treatment, they don't go to the doctor until they're at death's door. And then they go to the emergency room, which is literally the most expensive type of care that's available. Hospitals still have to treat them, costs surge, bills pile up, and the system snaps. And there's absolutely no warning, no safety net, and no way around it.
Destroying your healthcare. Number 5 is the fact that the Department of Education has recently announced that they are no longer recognizing certain allied health professions like advanced practice nursing as a professional degree. Therefore, they are capped at $100,000 aggregates for their federal student loans, which will make it difficult for them to be able to attain their education and decrease the workforce in the long run. Yet feels like chiropractors are still considered a professional degree. Number 4 is through the One Big Beautiful Bill, they are capping federal student loans for graduate level programs for professional degrees at $200,000 a year, which is not nearly enough to be able to cover the costs of going to medical school, as the costs of education have been skyrocketing over the last several years. So we're going to have less doctors going into these fields, especially primary care, that is not reimbursed nearly at enough rate to cover the expenses of student loans. Number 3 is the fact that the One Big Beautiful Bill has put in work requirements for Medicaid that has been shown never to work in states like Arkansas, which will actually make people lose their health care coverage, and many people will go without health insurance and get sick as a result. Number 2 is appointing RFK Jr. as Health and Human Services Secretary, who is completely gutted.
So today I logged into the health insurance marketplace to see how much it would cost me to be covered. I'm a single 34-year-old man with no pre-existing conditions and I'm very healthy. The only drugs I take are 10 milligrams of Lexapro and 10 milligrams of Buspirone. Want dental if it's possible. I get blood work done once a year and I get my teeth cleaned every 6 months. So I want my deductible to be less than $3,000. The plan that covered all of that was $704 a month. The deductible was $2,000 and it didn't even come with dental. So for me, one guy with no pre-existing conditions planning on visiting the doctor once a year, it's $9,000 a year. My health care won't be covered until I pay the $2,000 deductible. And I still have to pay extra for a teeth cleaning. I think we're broken.
No, you're not going to get free health care. Representative Mike Flood in Nebraska said flat out, America, it does not have unlimited money, and you're never going to have free health care. I suppose that what he should say was, if we gave you free health care, everything else that we're allowing for consumption, like the food, the water, the air, the prescriptions that we allow you to take, they're poison, and they cause harm to your body. And we can't give you health care that we pay for and poison you at the same time. That's a double-edged sword. We can't afford to do that. We would literally have to go back, change all the FDA guidelines, get rid of all the medicines that cause more harm than good, and quite frankly, we can't profit off the back end of lobbying dollars from insurance companies. That's what it is. And I don't care. Anybody who watched this damn dude on television, they know this man is a joke.
Let's talk about why we don't have universal health care in the US. It is not an accident. So after World War II, most wealthy nations, like UK, Canada, France, Germany, built universal healthcare systems. Although the specific methodologies and the timing and all that varied by country, it was driven by post-war reconstruction, the desire for greater social equality, and fears of social unrest, which I think we need to bring back. Many governments just moved to provide this comprehensive medical care for their citizens. And here in the US, they took a different route. They tied healthcare to employment through private insurance. Why? Lobbying and fear-mongering. So in the late 1940s, President Truman proposed national health insurance, but the American Medical Association, the AMA, launched one of the biggest smear campaigns in history, calling it socialized medicine and equating it to communism, which people fell for. And this narrative has stuck around for decades. Government healthcare equals loss of freedom. This isn't just about money or politics either. Racism has shaped this entire debate because in the 1940s and 50s, Jim Crow laws legally segregated hospitals and clinics across the South. Black patients were denied care, forced into overcrowded colored wards, or just refused treatment entirely. And Southern politicians knew that a national healthcare system would force desegregation, and they needed to avoid that at all costs. So Southern Dixiecrats in Congress joined forces with the AMA to block every single attempt at universal healthcare, framing it as a states' rights issue. Does this sound familiar? And they feared federal control meant that they'd lose the power to keep hospitals segregated. When Medicare and Medicaid were finally introduced in the 1960s under Lyndon B. Johnson, the federal government had to threaten the hospitals. You either integrate or you lose funding. And before that, more than 1,000 U.S. hospitals openly refused Black patients. And after desegregation, on paper, Black communities were still left with fewer hospitals and resources, underfunded clinics, worse care, a gap that we still see today. Some quick stats for you. Black infant mortality rates in the 1960s were twice as high as white rates. And today, despite spending more on healthcare than any other country, Black maternal mortality in the U.S. is 3 to 4 times higher than it is for white women. By the 1970s, private insurance companies and pharma giants realized universal healthcare would crush their profits. So they spent billions lobbying Congress, funding fake grassroots campaigns and pushing the idea that private insurance equals better care. It doesn't. This system benefits corporations and not people. The U.S. spends $4.5 trillion a year on healthcare, but our life expectancy is lower than countries with universal care. Where we are now, nearly 100 million Americans have medical debt. Over 41% of U.S. adults delay care because of costs. They ration their health care. GoFundMe is one of the largest insurance providers because people literally have to crowdfund surgeries and life-saving treatments. The U.S. could afford universal health care, but billion-dollar industries profit off keeping it broken. And we send a bunch of money overseas to Israel. So next time someone says we don't have universal health care because it's too expensive, please remember this. It is not just about money. It is about power, racism, and profit, historically.
And also, I just want to say that healthcare is a human right, period.
Americans are being priced out of staying alive, and the premiums are rising. And actually right now, the people who are entering into emergency are getting terrified, not because of the diagnosis, but because of the bills. And so many people are working, and they're not even able to afford their insurances. And right now people are choosing, is it groceries or paying for their premiums. And so many people are now struggling because of their health. And guys, it's becoming a nightmare to so many, because they are wondering, when did we ever reach here as America? They are wondering what really happened, because they voted for Trump. They believe that he will protect them. They believe that, the slogans that he kept on saying during campaigns, he will accomplish them. But right now, as from next year, the premiums will be rising. And so many people are saying that maybe they might cut off the insurance because they have no money to pay for it. And so many people have found themselves in debt because their treatment is, it's too expensive, and also because of the paying for their insurances. And guys, this shows a system that is broken. This portrays a system that does not care for its citizens, a system that once promised to protect them, to protect their livelihoods, their health, but right now it has showed betrayal. And so many Americans, especially the MAGA supporters, feel betrayed by the people they voted in huge numbers and the people they believed in. So guys, have you ever faced any biggest medical bill or an insurance nightmare? Kindly drop your thoughts, tell us what you did, and kindly don't forget to like, share, and subscribe to our channel. Thank you so much for watching. See you on our next video.